Rain needled the hospital parking lot fine and cold. A kid lay on the asphalt between painted lines, lips washed blue, chest high and tight. Morgan Hale dropped to her knees, glove needle alcohol. Her fingers found the second rib at the mid-clavicular line. She placed the bevel angled up a hair and drove the catheter in. Hiss. Trapped air escaped sharp as a tire giving way. The boy's throat clicked. Color crept back into his mouth. Morgan watched for rise for symmetry. Right side moved again. She pulled the stylet, kept the catheter, listened with 2 fingers in her eyes. A paramedic stood frozen with the gurney. He swallowed. "You're a nurse." "Tonight I am," Morgan said. "Trauma Bay 2. Tell them tension pneumothorax decompressed in the field. Get a chest tube ready." He blinked, then moved. The gurney rattled. Siren chatter rolled near the bay doors and vanished. Morgan stood. Rain stitched her scrub pants to her knees. Hands steady, she told herself. She stripped the gloves and walked inside. 72 hours earlier, Northbridge Medical Center glowed the shade of old ice. Fluorescence hummed. The lobby had the smell all hospitals collect at night, antiseptic wrapped around burnt coffee. Morgan kept her eyes on her badge as she signed in. Hiding in plain sight takes practice. She had practice. On the ICU floor, Lydia Ortiz pushed back from the nurse's station. Her bun was neat. Her eyes were not. Hale Wright night shift. "Yes, ma'am." "Drop the ma'am. We save that for families. You'll be fine if you keep your head down and your charting straight." Lydia slid a stack of laminates across the counter. "Codes phone trees drips. Make your rounds before the vitals move on you." Morgan nodded. "Got it." She logged on. Fingers fast until she noticed and slowed. The rhythm of 1,000 field reports wants to play itself everywhere. She made it play softer. Boots tapped hard on tile. Dr. Nathaniel Pierce, chief of surgery, tall and contained hair cuffed in gray at the temples, stopped at her elbow. He scanned the patient list over her shoulder as if it belonged to him, which it did. "You're new." "Morgan Hale." "You come from another hospital." "No, recently certified." One eyebrow climbed, older than most new grads. "Career change." "From what?" "Government work." He waited for more. She offered none. The corner of his mouth dipped. "Night shift, ICU is straightforward. Monitor vitals. Give medications as ordered. Call the attending if anything changes. Do not make decisions above your pay grade." "Clear," Morgan said. He tapped the counter once and moved on. The tap felt like a period. "Don't mind him," Lydia murmured. "He is like that with everyone, especially with nurses who look like they can think." Morgan smiled without showing teeth, noted. She started rounds. Pumps blinked in green. Monitors breathed in tiny square waves. A man snored softly through a nasal cannula. Morgan traced a line with her eyes from bag to vein to face, then compared it to the chart. She touched a shoulder, said a name, watched for the eye to find her. That was usually enough to know. Room 12 had a woman who slept on her side in defiance of her incision. The IV site glowed a faint red ring. Warm to touch. Shallow angle irritated wall. Morgan pulled the line set a tourniquet cleaned in a slow square and slid the catheter higher in one smooth motion. The flash popped into the chamber. She taped it down. The woman barely stirred. In the hall, Dr. Ethan Park walked by with a paper cup, saw the movement through the cracked door, and stopped. He knew good technique. This was better. Not fast for show. Fast because there was no wasted motion. He filed it where he filed things he might need later and kept going. At the far end near the window that faced the Black River, a man sat propped with pillows and the old look of post-op fatigue around the eyes. Harold Benton. Day 3 after bypass. The chart called him stable, the numbers nodded along. Heart rate in the 70s, oxygen in the high 90s. Pressure a neat 120/80. Morgan stood at the glass a moment, then went in. "Evening, Mr. Benton. How's the ride?" He smiled a tired smile. "Like I got worked over. Breathing deep hurts." "Where?" He touched his sternum with 2 fingers, then a little to the left when he coughed. Morgan listened to his lungs. Upper fields clean. Left base a shade quiet where it should not be. She watched his jugular vein and profile. A small ripple rose and fell under the skin with his breath. Not much. Enough to remember. She stepped out and found Dr. Pierce in the corridor reading labs on his tablet. "Mr. Benton has new localized chest pain with inspiration," Morgan said. "Diminished breath sounds at the left base. I recommend a chest X-ray." Pierce kept his eyes on the screen. "His vitals are fine. I examined him this morning." Lung sounds were clear. They are not clear now. Objective measurements, Ms. Hale. When they change, we act. Until then, we monitor. He is guarding, Morgan said. His posture has changed. His respiratory pattern is shallow. That is called post-operative discomfort. He finally looked up. His voice stayed flat and calm, the kind of calm people wear when they are certain. Do your job. I will do mine. Morgan held his gaze for 2 counts, then nodded once. Understood. At the sink, she scrubbed her hands. Betadine made a rusty halo in the water before it thinned and ran clear. She dried her fingers, then found the coin in her pocket. The metal had been smoothed by time and skin, challenge coin heavy in a way small things can be. She closed her hand around it until she felt the ridges press back. In through the nose for 5, out for 7. The cycle was simple and made the world simpler. By 2 a.m., the unit settled into its night hum. Lydia wrote orders with a pencil. A respiratory therapist leaned into a quiet laugh down the hall. Morgan charted and charted again, trends over snapshots. She did not need the reminder. Her body kept one anyway. Ethan drifted back to the station. How's 12? Sleeping better after a line change. He sipped coffee, made a face. How's the coffee? Punishment. He smiled at that. You see Benton yet? Yes. And watch him. Ethan studied her. He had learned not to fill silence, just to make noise. Okay. Morgan went back to the glass. Harold had turned slightly on his side, had tipped forward in a way people try when air feels heavy. She opened the chart, added a note about posture and respiratory rate increase from 16 to 20 over the last hour. Numbers still in range. The line of them told a different story. She made another pass through the unit. She checked Dopplers and pupils and the color that returns to a fingernail when you let go. She kept her hand steady and her voice steady and her face steady, which made other faces steady back at her. She did not think about the places where there had been no monitors and the air had smelled like hot metal and dust. She thought about the next room. On her way past the lounge, the smell of coffee sharpened and broke into bitterness. Lydia held up a cup as an offering. Morgan shook her head. The coin pressed a circle against her thigh when she moved. Near 3, the weather turned colder against the windows, and the hum fell another notch. A janitor's cart squeaked and then learned to move quiet. The hallway light stayed that patient shade of white that makes everyone's skin look the same. Morgan sat charted and listened. The unit had a rhythm. Once you learned it, you knew when it drifted. She looked up at Harold's monitor on the central screen and watched the green line make peaks at regular intervals. One of the peaks arrived half a breath late. She glanced down the hall to his door. He shifted in bed, a small wince near the sternum. She wrote a note to recheck in 10. Then she watched the waveform move again, tiny and exact. The beep ticked on. The new rhythm kept its own counsel. Hands steady, she thought. She stood. The late peak would not leave her head. Morgan walked to Harold Benton's door and stood in the spill of monitor light. His chin tipped forward. His shoulders held a careful angle that said the act of breathing had become a thing to manage. Mr. Benton, she said softly, how is your breath now? Like a heavy coat, he whispered. It pushes. She watched his hands. One drifted to the left of the sternum when he coughed. She listened again. Upper fields fine. Left base quieter than it had been. She checked the jugular at the neck and profile. A small climb and fall with each breath too visible for this hour. She wrote the trend, not the number. Respiratory rate from 16 to 21 over the last 90 minutes. Posture changed. Guarding with inspiration. Lydia rolled past with a med cart. You living in here tonight? He does not feel right, Morgan said. Page Pierce if he tips. You know how he is. I know. Ethan came up beside her, coffee in hand, voice low. Anything you want me to see. See him, she said. Ethan stepped into the room. He watched Harold breathe for 20 seconds. He looked at the monitor. He looked at Morgan. Numbers are pretty. The person is not. He nodded once. I will hover. At 4 minutes past 11, Morgan went to find Dr. Pierce. He was at a computer near the stairwell, blue light reflected in his glasses. She gave him the update. New localized pain. Left base diminished. Trend toward shallow guarded breaths. Visible jugular pulse. He did not look away from the screen. Saturation 97. Blood pressure normal. Heart rate normal. Patterns are shifting, Morgan said. He needs a chest x-ray. Do not order tests without an indication. He clicked to another lab set. If he decompensates, you call me. He is decompensating slowly, she said. That is still decompensating. Pierce finally turned. Calm face, calm voice, the calm of someone certain he is the gate. You are a nurse. Do your job. The tap of his finger on the desk came again. Period. End of sentence. He walked away. Morgan stood a moment in the corridor, feeling the old weight stir in her ribs. She went back to Harold's room and set the oxygen to a flow that matched his comfort, not the textbook. She told him what she was doing. She watched the muscles between his ribs on the left work a little harder for each breath. At 23:43, the unit changed pitch. The alarm came from room 8, a tone that pulled people to their feet before thought. Morgan moved without running. Her mind made the room a map before she crossed the threshold. Harold was bolt upright, eyes wide, mouth open around a breath that could not find room. The color had drained from his lips. The skin at his neck was full. The monitor number stuttered, then fell. She hit the code button and went to his side. "Mr. Benton, look at me," she said. "I am here." He could not answer. She placed her right hand on the lower sternum and felt for the heart through bone and muscle. The sounds in her stethoscope were soft and far away. Muffled. She kept her hand still long enough to learn the motion under it. That motion told her what the numbers were about to say. Blood pressure dropped to 60/30, oxygen 89. Heart rate climbed in a ragged climb. The wave on the screen loosened. "Tamponade," she said to Lydia, who was already pulling the crash cart. "We need the kit." "Pierce is on his way," Lydia said, pressing a bag valve mask into Morgan's hand. 2 liters oxygen, Morgan said. "Push." Keep his head midline. She lifted his gown, found the xiphoid, with 2 fingers cleaned the skin with iodine in a quick square. "Draw up lidocaine." The door burst, and Dr. Pierce entered with 2 residents. He took in the room in one look. "Move. Get cardiothoracic on the line. Prep for the OR." "He will not make the elevator," Morgan said. "Ms. Hale, stand back." "He will not make the elevator," she repeated, not louder, just closer. "He needs a pericardiocentesis now." "That is not your call." The monitor screamed a longer tone. The rhythm buckled. Harold's head tipped. The line on the screen flirted with flat. Lydia's eyes flicked to Morgan's. That was all. "Stop compressions," Morgan said as she took the spinal needle. "On my count. 1, 2, stop." For a half breath, the room held itself. Morgan placed the needle just below the xiphoid, angled toward the left shoulder. Her left hand steadied the skin. Her right hand advanced, millimeter, then millimeter in a line she could see without seeing. At 4 centimeters, there was resistance. At 5, the hub darkened. She pulled back on the syringe. Blood as dark as old wine filled it warmly and fast. She kept gentle suction, felt the pressure give a little as the fluid left the sac. 10 milliliters, 20, 30. "Rhythm." Lydia said, voice tighter, "We have a rhythm." The monitor cut back into a pattern that made medical sense again. Blood pressure crept up from 50 to 60, then to 70/40. Oxygen climbed to 90, then to 92. Harold opened his eyes halfway and looked around as if the room had been underwater and now rose toward air. Morgan kept the needle steady until the last fraction of a give left it. She withdrew with the same care she had used to enter. She pressed gauze to the skin and held it there. "He needs surgical repair," she said. "Now he can get there." Pierce stood at the foot of the bed. For one long second there was nothing on his face. Then his jaw unlocked. "Page, cardiothoracic again. Tell them the tap was successful. Move." The team found its next rhythm. Monitors reattached, lines tidied. A portable ultrasound slid across the sheet to confirm the fluid had gone. The transport team arrived with a rolling storm of rails and straps. As they lifted Harold to the gurney, he reached for a hand. Morgan's was there. His fingers squeezed with surprising strength. No words. He had no room for words yet. Then he was gone up the hall under lights that turned everything flat and bright. The unit exhaled. The silence had a shape. Morgan stripped her gloves. Betadine made brown maps over her knuckles. She went to the sink. Water turned pink, then light pink, then clear. Lydia came to stand beside her with 2 paper cups. "Terrible coffee," she said. "I recommend it." Morgan took one. The bitterness put a line through her tongue. She held the cup in both hands to keep from feeling the adrenaline shake that wanted to start in her fingers. Ethan leaned on the opposite counter. "Where did you learn to do that?" "Training," she said. "What kind?" "The kind where you do it or someone stops being alive." He studied her. "You were military." She did not answer. He nodded anyway as if she had. At 8:45 the next morning, Morgan sat across from Elena Marquez in a glass office that smelled like furniture polish. Dr. Pierce sat to the side. A man with a briefcase occupied the third chair and introduced himself as counsel for the hospital. Elena's tone was careful. We reviewed the events involving Mr. Benton. You performed a pericardiocentesis without a physician order in a code situation. He was dying, Morgan said. Compressions had begun, the lawyer said. An attending physician was present. He was decompensating too fast to move. Elena folded her hands. Your actions, while effective, were outside the scope of practice for a registered nurse in the state. The liability to this institution is considerable. Morgan turned to Pierce. Do you think I was wrong? Pierce met her eyes. You violated protocol. That is not what I asked. He held the look for account. You were not wrong. Elena closed the file. We are terminating your employment effective immediately. You will receive 2 weeks of severance. Your badge will stop working this afternoon. Morgan stood, understood. Pierce opened his mouth, closed it, then said very plainly, You saved his life. That helps him, Morgan said. It does not help me. She left her badge on the desk. Lydia texted her before she had crossed the lobby. Heard. I am here if you need anything. The letters made a small ache she ignored. In the locker room, she changed slowly, folding the scrubs as if that mattered. Her phone buzzed with an unknown number. Morgan Hale. Captain Hale, a voice said, male and careful. This is Sergeant Travis Cole. We served together in the 75th Afghanistan. I am in your emergency department with a broken femur. I saw you on the ICU floor last night, thought it was you. Then I heard about the pericardiocentesis. She pressed the phone closer to her ear. You have the wrong person. I will not use your name again, he said. The voice softened. Good to hear you breathing. The line clicked off. She stared at the gray tile. The ceiling vent hissed softly. She put the phone back in her pocket. Another call came 2 minutes later, unknown again. Hale. Captain Hale, this is Colonel Mark Ellison with the Defense Health Agency. The voice did not waste words. There has been a construction collapse downtown 6 blocks from Northbridge. Mass casualty event. Multiple criticals inbound. They will be overwhelmed. I do not work there anymore. I know. A pause. People are dying. She ended the call without a goodbye. She walked to the parking lot in the kind of silence that exists after alarms. Rain had returned and polished the asphalt to a mirror. She sat in the driver's seat and did not turn the key. The steering wheel felt too smooth. In through the nose for 5, out for 7. Her hand closed on the coin in her pocket. The ridges pressed into her palm until they hurt in a good way. Then the first siren slid past the hospital entrances. Another came from the west. Then 2 more from the south, voices that rose and fell and climbed over each other as if they were trying to talk at once. The sound poured around the car. She started the engine and stared at the windshield. The wipers moved, clearing lines that filled again. The sirens kept coming. The sirens braided into a single rope of sound. Morgan turned the wheel and slid under the ambulance canopy. Medics rushed past with gloved hands and clipped voices. The doors to the trauma bays hissed open and dumped heat and bleach and metal into the air. She moved with the current. Supply closet, second shelf, spare scrubs. She changed fast, hair up, badge pocket left empty. The coin stayed in her right pocket. It felt heavier than clothes. The emergency department had filled in layers. A wall of voices monitors stacking beeps into a harsh kind of music, gurney wheels chewing at the floor. Ethan stood at the center with a clipboard and a pen he never looked at. He pointed as teams formed around beds, where Morgan said, he did not waste the second it took to be surprised. He pointed to bed 4. Keep him alive. Bed 4 belonged to a boy who should have been in a class somewhere. 19 at most. Dark hair stuck to his forehead. A bar of rusted steel entered below the right clavicle and came out near the scapula. The skin around both holes had pulled taut. Every thin breath made the metal quiver. Name, Morgan said, gloving up. Jake Romero, a nurse, answered. 19, site collapse at Riverside, vitals spiraling. Morgan placed 2 fingers on the carotid, fast and weak. She leaned close to his mouth and heard the small torn sound the air made as it tried to pass. Jake, I am Morgan, she said. Look at me. His eyes found her. There was a lot of fear in them and something like apology, as if he had done this himself. You are here. Do not move. Breathe the smallest breaths you can. I am going to keep you still. He nodded because nodding was all he had left. Ethan slid in beside her with a portable ultrasound. You want this? Yes. The gel was cold. She angled the probe and built a map in shades of grain. Rib shadow, lung sliding, black where it should be black. The bright line of the rebar cut the picture in two. She tracked it from the entry point along the path it had made for itself. Subclavian missed by millimeters, she said. It kisses past second rib, stops near the right pulmonary artery, 2 millimeters, maybe less. Ethan let out a breath he had held too long. So he cannot move. He dies in the elevator, Morgan said. She kept her voice level. He needs to be stabilized here. Dr. Pierce is with a crush abdomen in 3, Ethan said. I will get him. Bring him. Also bring vascular clamp, suture chest tube, tray suction. Lidocaine fentanyl, low dose. I need hands. A set of crutches clicked up to the foot of the bed. Sergeant Travis Cole looked down at Jake, and then at the rebar, and then at Morgan. His hospital gown had a blanket thrown over it like a jacket. His right leg was in a bright white cast. His face had the kind of calm you only earn by losing it first. You should be down, Morgan said. Not tonight, he said. Tell me where to stand. You are not staff. I can hand clamps, he said, and did not wait for permission. Ethan returned with a cart and Dr. Pierce. Pierce stopped at the foot of the bed the way he had in ICU, taking possession with nothing but stillness. His eyes moved once over the scene. He needs an operating room, he said. He will not make the elevator, Morgan said. Look at the ultrasound. Ethan held up the screen. Pierce looked for 3 seconds and went a shade paler the way experienced men go pale when math turns against them. That is impossible to do here, he said. It is necessary to do here, Morgan said. Give me authorization. This is not within your scope. Neither is watching him bleed out on a stainless elevator floor. For a moment, it was only the beep and the soft drag of Jake's breath. Pierce looked at Jake. He looked at the steel. He looked at Morgan. Then he nodded once. Do it, he said. I will back you. Ethan draped. Lydia appeared without being called, sliding antiseptic across skin in a wide square. Morgan drew up minimal analgesia enough to soften the edge without making the lungs forget their job. Jake, I will make 2 cuts, she said. 1 to give me room, 1 to make your right lung breathe easier. You will feel pressure. I will talk you through it. His eyes told her he heard. Sweat had made a clean line along his hairline. His lips were pale. He did not look at the rebar. He looked at her. Hands steady, she whispered to herself. She did not need to say it out loud for it to be true. Scalpel. She lengthened the skin around the entry site by a finger's width. Blood welled slow and dark, not arterial. She packed gauze around the steel to keep it from rocking. She followed the tract with 2 gloved fingers, feeling for what the gel had shown. Bone fragments were lodged where the rib had cracked. She teased them free and lifted them out on a square of wet gauze. Clamp, she said. Travis handed it. His hands did not shake. She found the small ooze near the arterial wall, the one that would tear wide if the metal shifted a hair. She placed the vascular clamp with careful pressure and asked for another to back it. Vitals, she said. 70/40, Ethan said. Heart rate 138, oxygen 88 and climbing. Slow climb. Chest tube, she said. Right side 5th intercostal anterior to mid-axillary. She made the cut spread. The muscle felt her way along the rib and pierced the pleura. Air rushed out with a thin sound. Then blood followed, not a surge, but enough to make the tubing blush. She connected suction and watched bubbles dance and then smooth. The monitor answered. Oxygen crept up to 92, 94. The tremble at the corner of Jake's mouth eased. His eyes lost a fraction of their wildness. Hold this, she told Travis, guiding his hand to the gauze that cradled the rebar. Do not let it move. Yes, ma'am, he said. He put his weight into the thing the way you put weight into a friend who is trying to stand up. Dr. Shaw is on her way, Ethan said. Operating room being prepped. Perfusion is on call. Tell them the rebar stays until bypass is ready, Morgan said. The clamp is temporary. Dr. Priya Shah arrived as if she had been written into the room. She took one look at the ultrasound printout, then at the clamps and the chest tube and the boy who had started to look like a person again. You saved me 40 minutes I do not have, she said to Morgan. We go now. The transfer to the transport gurney was a ballet no one had rehearsed, but everyone knew. The steel did not shift. Hands moved together. The rails clicked. As they pushed, Jake turned his head just enough to find Morgan again. You are okay, she said. Keep breathing small. See you upstairs. His lips moved. It might have been a thank you or a prayer or a name. Then the doors took him, and he was gone. The noise of the department did not stop. It never stops. It only changes shape. For a moment, Morgan let it wash past her and stepped away to the sink. Her gloves came off and fell into the bin. Betadine made brown stars on her skin. She scrubbed until the water turned from pink to clear. The coffee at the nurse's desk had grown a skin. She drank it anyway and felt it cut a harsh line through her mouth. Ethan leaned against the counter and looked like a man who had seen something he would think about later when there was time. "What are you?" he asked quietly. "Someone who does not like elevators," she said. Lydia snorted. "That is one word for it." Dr. Pierce came to stand across from her. He tucked his hands into the pockets of his coat so she would not see if they shook. "You did well," he said. She looked at him, waiting for the other shoe. It did not drop. He added, "You are also off the schedule." "I know." He held her eyes for a moment longer than his position required. Something like respect clicked into place. It did not erase anything. It made standing in the same room less sharp. Upstairs, the overhead speakers called for blood for cardiovascular support for a nurse who had somehow managed to be needed in 2 places at once. Morgan stayed on the ground. The floor nurses moved past her with purpose. She checked on 2 other patients who needed hands that could be calm on a forehead. An hour later, a hospital administrator appeared in the doorway to the physician lounge and asked for Dr. Pierce. Elena Marquez stood in the hallway outside with a man in marine dress blues. The man held a sealed envelope with a block of letters that made people straighten by reflex. "Delivery for hospital administration regarding Ms. Morgan Hale," the Marine said. "Confirmation of receipt required." Elena broke the seal with a fingernail. She read the first page, and her expression changed from brisk to careful to something she concealed by blinking. She handed the papers to Pierce. He read fast and then slowed. Elena looked at Morgan. "Come with me." They walked to a smaller conference room that had a pitcher of water sweating on the table. Elena laid the papers down and turned them so they faced Morgan. It was a letter on government paper with lines where words should have been and words where you expect lines. It spoke of service under a designation she had not said aloud in months. It listed commendations she had not touched. It named a thing called Ravengate and said the intelligence had been compromised. It said the orders had been bad. It said the fault did not belong to the hands that had followed them. Morgan read the paragraph again. The words did not change. The way her shoulders held themselves did. Pierce watched her face rather than the paper. He saw it land. "You were set up," he said. It was not a question. Morgan kept her eyes on the page. The letters blurred once and then steadied. She felt the coin in her pocket through the fabric, a hard circle in a world that had too many soft edges. Elena cleared her throat. "There is also a recommendation," she said, "from the Surgeon General's office. It suggests that we consider you for a civilian leadership role in trauma and tactical training. Full privileges in emergency situations." Pierce spoke before Elena could add the rest. "We want you back," he said. "Not as a night nurse. As someone who can change how this place thinks in a crisis." Morgan looked from one to the other. The hospital smelled like iodine and plastic and money spent on a new floor wax. Somewhere a radio mumbled under a stack of coats. Her hands did not shake. The old tremor had left with the last rinse of pink. She set the letter down and slid it back across the table with 2 fingers. "I have conditions," she said. Elena waited. Pierce waited in the way people wait when they want a thing and do not want to show it. "Train everyone together," Morgan said. "Nurses, residents, attendings, paramedics. Same room, same drills." Elena glanced at the counsel in the doorway. "We can discuss scope." "No silos," Morgan said. "That is the scope." Pierce said, "Agreed." "Full autonomy in emergencies," Morgan said. "If I say an intervention is needed, I do not stand in a hallway asking permission." Elena's lips pressed into a line. "The liability is not small." "The liability is leaving someone to die while we shuffle signatures," Morgan said. Pierce's voice came quiet. "Within the emergency department in declared emergencies with documentation after." "Agreed." Elena hesitated, then nodded. "Agreed." "Military-style mass casualty protocol," Morgan said. "Roles by function. Red, yellow, black zones. Staging for blood and devices. Triage that moves." Pierce said, "You will write it with me." "Last thing," Morgan said, "no surrender while there is a pulse." Counsel cleared his throat. Elena cut him off with a palm. She held Morgan's eyes, put it in writing. "Senior trauma consultant, training lead, full clinical authority in emergencies. We move on this now." "We also need a room," Morgan said. "Simulation space, ultrasound, chest tube kits, tourniquets, a rebar mock-up." "Take the East Conference suite," Elena said. "Tell purchasing what to buy. Make the list short and hard." "Good," Morgan said. Pierce allowed himself a breath he had not planned to show. Welcome back. 2 weeks took on a shape. The East Conference suite became a bright box with rubber torsos on steel frames and monitors that could lie on command. Tape grids on the floor showed where feet belonged. Whiteboards held phases of drills. The air had a hum of plastic and new foam and gel. They came in crews, night nurses with sharp eyes, residents who wanted to be fast and had not learned yet that smooth was faster than fast. 2 attendings who watched with folded arms for an hour and then rolled up sleeves. Paramedics who stood with their hands in their pockets until the first scenario started, then moved like water. Morgan worked stations with the rhythm of someone who had carried a stopwatch and a tourniquet in the same pocket. Less talk, she said. More hands. She placed a challenge coin on the edge of the table at the front. Metal face up, ridges bright. No speech about it. It sat there like a dropped anchor. Needle decompression, she said. Find the landmarks with your fingers. Do not measure with your eyes. Stick. Listen. Becca Lane stood at the mannequin's side, a third-year resident with a braid and a face that showed every thought and then learned not to. She had frozen for 3 seconds in a coded case in January. She had not forgiven herself. Her hands now were steady because she made them steady. Morgan watched her place the fingers count rib spaces, set the angle and drive. Air hissed. She tapped the monitor. The simulated oxygen rose. She clicked the stopwatch. 2 minutes 40 seconds, she said. Do it in 2. Becca frowned. 2 is not realistic. People die in the 40, Morgan said. Again. They ran the drill a second time, then a third. Becca learned the feel of the cartilage under the skin, the change from resistance to slide the moment where you hold the catheter and pull the stylet. Her shoulders lost the small lift of fear. At the next table, a paramedic named June wrapped a tourniquet. Morgan moved his hands a finger's width higher. Closer to the joint, she said. Turn until the pulse is gone, not until it is tight. Say it back. Turn until the pulse is gone, June said. On another mannequin, Ethan ran a chest tube station. Morgan corrected an angle, lowered a shoulder, and told him to listen more than look. He did and nodded. They practiced rebar stabilization using a steel rod fixed to a weighted base. Gauze packs, gutter sutures that hugged metal and kept it from breathing along with the chest. The room learned to move together without stepping on each other. By the 6th day, time improved. 2 minutes 40 became 2:10. 2:10 fell to 2 flat. Becca kept the anchor needle in her hand after the last drill and looked at it the way you look at something that used to scare you. Again, she said. The overhead speaker cracked at 3 in the afternoon. Trauma alert, mass casualty, industrial explosion in South Park, multiple criticals inbound, all available staff to emergency. The room held still for a breath. Chairs slid back, gloves snapped. The coin on the table flashed under the fluorescent light. Becca looked at Morgan. I can take triage. Morgan measured her for a second. The braid was tight, the jaw was set. There was fear in her eyes, and it was the right kind. You have it, Morgan said. She picked up the coin and closed Becca's fingers around it. Zones on the south side of the bay, red closest to the doors. Keep the yellow moving, call black early, hands steady, hands. They moved as a unit. Supplies rolled, tarps snapped down, blood coolers arrived with a sound like ice breaking. Oxygen tanks lined up like a row of green shoulders. A whiteboard went up with columns for counts and times. The ambulance canopy bloomed red impulses that painted the glass. The first rig backed in hard. The doors flung wide and 3 bodies came out as if pushed by the same hand. Red 1, Becca called without shouting. Male 30s chest wall unstable. Bed 2, needle in bay. Red 2, a medic called. Partial amputation right below knee, tourniquet applied in field. Yellow 1, another said. Burns 20% airway clear. Red 2 to Hall A, Becca said. Pressure dressing on stump. Second tourniquet if bleed breaks. Warm patient. Yellow 1 to Hall C with fluids. Chest to bay 2 now. Morgan walked at Becca's shoulder and did not step in front. She held the clipboard that tracked minutes and spoke when speaking kept seconds from slipping away. Vitals, Becca said as the flail chest man hit bay 2. 78 systolic, Lydia answered. Sats 85. Needle decompression right side, Becca said. 5th space, linens off, landmark and stick. The resident to her left hesitated for half a heartbeat. Becca took the needle herself. She found the intercostal space with 2 fingers. She set the angle. She drove. Air hissed like a secret leaving a room. The oxygen number climbed in slow single steps. Bag with small breaths, Becca said, not too fast. Morgan watched the way Becca's shoulders did not rise. She watched her eyes track hands and not faces. She nodded once to herself. That was all. Pierce appeared at the edge of the bay. He did not take command. He watched Becca's voice carry. He watched lines get placed where they should be placed. He looked at Morgan and did not need to say anything. A second wave rolled in. One man with a belly like a drum gray around the mouth, eyes glassy. Becca put her hand on his abdomen and felt the quiet. Red 3 to CT hold. Surgeon to bedside. 2 units on pressure. Call OR. A teenage girl with soot in her hair and a cough that clawed. Yellow 2. Becca said, then tipped her to red when the cough turned wet. Move her up. Nebs. Monitor for burns in the airway. A woman who did not move and did not breathe. The medic shook his head once. Becca held up a hand and pointed to black. She stood there for a second longer than the others. Then she turned away and found the next voice calling the next set of hands reaching. Count Morgan said at the board, Reds, 3 yellows, 4, black 1. Beds open in OR, 2 ICU 3. Blood used 6 units. Chest tubes 1. Keep the red flow, Becca said. Slow the yellows, stabilize and push them upstairs or out. No reds waiting. Morgan stepped to a corner for a drink of water that tasted like rubber and metal. She looked at the face of the emergency department as it moved. It had a shape now, not just motion. It held. A paramedic drifted near with his hands empty for the first time in an hour. Your doc leads like she was born here, he said. She learned, Morgan said. The next ambulance braked at the edge of the canopy. The driver's face was gray with sweat. The back doors swung open. Becca lifted her chin. Red incoming, she said. Bay 3 ready. She slid the coin into her scrub pocket and squared her shoulders. The doors banged, the gurney rolled, and the room leaned forward together. The last ambulance peeled away from the bay. The room exhaled not in relief, but in the way a body breathes after a sprint. Floors showed the tracks of wheels. Gloves lay curled like shed skins in corners. The sink ran pink, then pale, then clear. Someone laughed in a low, tired way, and it sounded almost like a cough. Becca stood in the middle of the triage grid she had drawn with tape and a marker. The coin in her pocket made a small weight at her hip. She touched it and then took her hand away as if the act of noticing might make it vanish. Pierce joined Morgan at the whiteboard. He read the totals, the times, the units, then set the marker down. No reds waited more than 4 minutes, he said. CT turnaround beat the last drill by 7. Becca kept flow, Morgan said. Pierce nodded. You built it. She moved it. Becca crossed to them, cheeks flushed under a smear of soot. Bay 2 is up. Burn team took yellow 4. Black remains at 1. Morgan tipped her chin to the coin bulge. You kept it steady. Becca showed a small, quick smile. My hands listened. Good, Morgan said. She reached into her pocket, took out the coin, and placed it on the table between them, beside the one Becca carried. 2 circles of metal caught the overhead light. Yours now, she said. Mine stays here. Becca curled her fingers around the coin and looked a little like someone who had been handed a key. She did not put it in her pocket again. She kept it in her palm. Laundry carts rolled in. The air picked up a clean chemical edge. Lydia wrote 3 lines on the board that nobody spoke, but everyone saw. Debrief at 1900. Replace kits before you sit. Hydrate, eat, change. Morgan scrubbed her hands until the water ran clear and the scent of betadine gave way to soap. She lifted her face to the paper towel for a second longer than the act required. The shake did not come. Upstairs, Dr. Priya Shah called down to the desk and reported Jake Romero in ICU intubated perfused stable. The nurse relaying the message had a grin in her voice. Morgan closed her eyes and let that word steady take up a little room. Evening slid into the glass. The river turned a soft black under the hospital windows. Debrief circled through the group and stopped at Becca. She spoke in the clipped language the room understood. One soft call out to the resident whose needle had found air on the first try. One clear correction on a tourniquet placed too far down a thigh. No speeches. A story in the shape of facts. Pierce cleared his throat. Trauma survival is up 23% since we started this, he said. That is not a number I have seen here. No one clapped. The room had no free hands. The information sank where it needed to. Weeks layered over the unit. The East Suite buzzed daily. Monitors lied on command and then told truth. A plastic chest rose and fell in someone's hands, and that someone learned to make it do both. A poster went up that said, triage zones with arrows, not words. A crate appeared in the corner labeled tourniquets that did not stay full for long. A shelf case on the wall held a line of coins behind glass. The first was old and heavy. Others joined it, each one earned. Names were written under them in dry erase and sometimes in permanent ink. Jake Romero came back in April wearing a flannel and a careful grin. A woman held a baby in a yellow cap at his shoulder. Jake's breath sounded like it belonged to him. The scar outlined a story beneath his collarbone. "Captain," he said, then corrected himself. "Morgan, we wanted to show you something." The baby blinked at the fluorescence and made a fist that could not hold anything yet. Jake did not try to make her hold anything. He just held her. "What is her name?" Morgan asked. Hale, Jake said, eyes wet and unapologetic. It seemed right. Morgan's mouth shaped into a smile that might not have been visible unless you were looking for it. "She looks like a fighter," she said. She touched the baby's palm with her fingertip. The fingers closed once and let go. "Dr. Shaw says I'm cleared for light duty," Jake said. "Not ready for rebar, but ready for being alive." "Keep breathing," Morgan said. They left with a wave that changed shape when the elevator doors opened. The coin case caught the light as they passed. On a Friday, the East Suite filled with new faces, badges from other cities. A paramedic from Spokane, a night nurse from Boise, a resident from Portland with a haircut that said he cut it himself. They sat in rows that had no rank. Pierce stood in the corner with his arms folded and his mouth relaxed. Elena watched from the doorway and wrote quick notes on a legal pad that would turn into budget lines later. Morgan stood by a screen and did not pretend that slides were more important than hands. "My name is Morgan Hale," she said. "We are going to practice how to act when the room decides it does not care about your plan." She did not talk long. She moved. She put a scalpel in a hand. She set a timer. She made the room find a rhythm. She let Becca teach a station and watched how the braid moved with her shoulders. She watched a paramedic named June correct a resident's grip gently and saw the two of them nod in the same way. In a break, a phone on the counter lit up with an out-of-state number. A voice introduced herself as Dr. Sarah Chen from Johns Hopkins. "Pile up on I-95. 12 criticals inbound. Team ready, but not for that many at once." "Put me on speaker," Morgan said. She spread a floor plan on the table and walked them through station zones, blood staging who speaks and who writes. She described in 10 sentences how to keep red from stacking and how to move yellow without breaking it. 3 hours later, the same number called back. A different sound in the voice now. "All 12 stabilized," Dr. Chen said. "0 preventable deaths." The line went quiet for a second that did not need words. "Thank you. Your team did it," Morgan said. She hung up and looked at Becca, who had been listening from the next table. Becca shook her head slightly and then smiled with her mouth and her eyes at the same time. That night, the unit moved through its steady hour. The smell of coffee that had been on too long drifted from the lounge and mixed with iodine and plastic. The whiteboard had a clean face. The coins in the case made small circles of gold and silver in the overhead lights. At the sink, Morgan watched water run over her hands. It went from pink to clear in 2 heartbeats. She turned off the tap and listened to the room. Monitors clicked, shoes whispered. Somewhere in the stairwell, someone sang a line from a song without meaning to. She stepped to a new nurse at a training mannequin in the East Suite. The young woman held a needle and a catheter and a breath she had not let out. Morgan touched her elbow. "Find the rib with your fingers," she said, "not your eyes." The nurse nodded. She placed her hand, counted the spaces, set the angle, and drove. Air hissed from the plastic chest. The monitor number rose. The nurse let out her breath and laughed once, quiet and bright. "Again," Morgan said. Later, Pierce joined her at the door and looked at the room as if it were a painting he understood better today than yesterday. "You changed this place," he said. "You changed me." "I changed how we practice," Morgan said. "That is what I meant." They stood a moment longer and watched the third-year resident, who had learned to move without apology, teach a first-year how to tie a knot. Outside, a siren called and then passed by. It did not pull at Morgan's chest. It set the tempo. She slipped the old coin into the bottom slot of the case. The metal clicked against glass. The name card under it had her name in small letters and another line below that said team. She closed the case and turned to the floor. The unit breathed. She matched it, hands steady. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.